Diabetes Insipidus by Marissa Andrews, Allyssa Christie, and Rachel Collins. This is Joe.
Joe has come to the clinic to talk to a registered nurse about his recent diagnosis of diabetes insipidus. The nurse will debrief him on how the disease is defined, the signs and symptoms, causes and risk factors, and overall effect of diabetes insipidus on normal physiology.
Diabetes insipidus is an antidiuretic hormone disorder in which the kidneys are not able to prevent the excretion of water. There are two types of DI, nephrogenic, which occurs because the kidneys do not respond to ADH, and central, which occurs because of a defect in the synthesis or release of ADH.
Common symptoms include excessive thirst, increased urine output from 2 liters to 20 liters a day, lethargy, and muscle pain. Causes of central DI include genetics and damage to the pituitary gland from infection, inflammation, or loss of blood. Causes of nephrogenic DI include genetics, chronic kidney disorder, or kidney disease that causes defects in the kidney tubules, drugs such as lithium, and high levels of calcium.
Normally, blood enters the kidneys through the renal artery, which branches into what eventually become the glomerules. The glomerules are clusters of thin-walled capillaries. The porous nature of the glomerules filter the blood through the capillary walls and excrete large amounts of filtrate into the Bowman's capsule. The Bowman's capsule passes the filtrate through the proximal tubule, which reabsorbs molecules such as sodium, calcium, amino acids, and glucose. The filtrate then reaches the loop of Henle, which is broken into 2 parts, descending and ascending limbs. The descending limb absorbs water, while the ascending limb absorbs ions such as potassium, calcium, and sodium. The filtrate then passes through the distal tubule and empties the remaining fluid into the collecting ducts to eventually reach the urinary bladder for excretion. Water reabsorption also occurs in the collecting ducts, but only with the presence of antidiuretic hormone. ADH opens aquaporin protein channels located on the cell membrane to allow water to enter the cell. The release of ADH is stimulated when specialized nerve receptors known as osmoreceptors found in the hypothalamus detect the drop of osmotic pressure in the body and sends a message to the pituitary gland to stimulate the synthesis and release of ADH.
In abnormal physiology for central DI, damage to the pituitary gland disrupts the normal synthesis, storage, and release of ADH. When ADH is not being produced or released, it inhibits the collecting ducts from reabsorbing water, which leads to the symptoms of extreme thirst and increased urination. Additionally, in nephrogenic DI, damage to the kidney tubules is due to chronic kidney infections, kidney disease, or lithium-containing drugs. Damage to the kidney tubules do not allow the receptors to receive or respond to ADH.
Available tests to test for DI include the water deprivation test. Water is withheld for several hours, and body weight, ADH, and urine output and concentration are then monitored. Urinalysis, a physical and chemical examination of urine, or an MRI. An MRI is used to observe abnormalities in or near the pituitary gland.
Diabetes insipidus cannot be cured, although there are treatments available for managing symptoms. For central DI, a synthetic hormone called desmopressin mimics ADH properties that eliminates the need to urinate frequently. It can be administered nasally, orally, or by injection. For nephrogenic DI, a low-sodium diet is recommended to reduce the amount of urine produced by the kidneys. A drug called hydrochlorothiazide that discourages the absorption of salt is administered.
In summary, homeostasis. The lack of ADH or the kidney's unresponsiveness to ADH does not allow water to be reabsorbed by the collecting ducts, which disrupts the balance of water in the body. Proteins. Aquaporin is a protein channel found in the cell membrane, which allows water to enter the cell in the collecting ducts to be reabsorbed. Cell membranes. The permeability of cell membranes to water depends on the presence of aquaporins. Aquaporin channels on the cell membrane are regulated by ADH. Since diabetes insipidus is caused by the lack of ADH, cell membranes are affected.
So, Joe, do you feel like you have a better understanding of diabetes insipidus?
Yes, I do. You guys are the best nurses ever.
Created using Powtoon.